Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board-certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun.
Hey guys, do I have the episode for you today? I have two fabulous surgeons from Beverly Hills, Dr. Fayan Jalalabadi and Dr. Charles Galanis. This is our first duo episode, so I'm excited to see how it goes. Let's get to the episode. I'm so excited to have y'all on, though. You know what? You guys, I love watching y'all bicker on Instagram.
It's real. Believe me, you're seeing 5% of it.
Really? I hear y'all have some group chats that get lit.
You have group? That may be him. I have nothing to do with that. That's probably him.
Which little bird told you that?
I have birdies all over the place.
All over the country, all over the world, I bet.
All over the world.
I'm gonna put that angel one up right now. I'm gonna just be like,
oh yeah.
We had these filters that we were doing before. There's one that has a halo. It's a halo over my head. I was just sitting there like this. Made me look. It was perfect.
It really suits its character.
You should have horns.
I know.
Oh, I thought this episode would be really interesting for us to talk about. I mean, there's so much that we could talk about, but specifically about advancements in technology that help you give your patients a better result. I know you had a really funny post today about technology and the advancements. It was actually Dr. Galanis who posted it today about it was, you're like, wait, I didn't post that. That was actually my social media. Okay, it's about the skin tightening after liposuction. And I think that's a really interesting topic we could talk about because everybody wants the skin tightening after liposuction. But of course, we know not all the surgeons offer the skin tightening treatments. And the ones who don't offer it talk about the ones that do offer it. And the ones that do offer it are like, hey, we're just trying to make it better. So I'd love to hear y'all's take on it.
Okay, you asked about technology as it relates to sort of skin tightening after liposuction. And I think, we both sort of employ a particular kind of technology to enhance skin tightening. But one thing I would sort of preface it with, when anyone asks about technology is, and I know you would agree with this, technology doesn't replace the surgeon. And I typically will tell patients, when they'll be asking about whether it's a skin tightening device or if they use phase or something like that, is I always say, it's probably better to pick your surgeon based on their results rather than their toys. And I think that anyone that sort of props up, I have this device, therefore you should come to me, it's probably a smokescreen. Or maybe it's just a little bit of overly aggressive marketing. So for me, I know what I've been using for several years as it relates to liposuction is, one of the things with liposuction, you're taking the fat from underneath the skin, obviously. Now, what you're relying on is the body then for the skin to retract down. Similar to when like Dr. Jalalabadi is doing a rhinoplasty and you're addressing what's underneath the nose. You don't take any of the skin away. The skin is just gradually going to kind of shrink down to that new shape. Same thing with liposuction. The difference is the skin over areas where you liposuction doesn't always do that as well as we want it to. If it's damaged skin, if it's skin that's been affected by previous pregnancies, weight gain, maybe there's been surgery before. And so one of the things that we've always been desiring, or one of the things that would be a great adjunct to liposuction is therefore something that's going to enhance the tightening. So getting back to your original question of this long round of discussion, is radiofrequency is kind of the technology that's been really sort of discovered in the last several years to enhance collagen synthesis and therefore tissue tightening. And essentially what it is a controlled thermal injury. There are things like BodyTite, Renuvion, there's a new device coming out of Columbia called Retraction. All these devices use radiofrequency to heat, remodel collagen, and therefore tighten skin. So do I think it works? Yes. Do I think you have to have it to have a good result? No. Essentially what I'll tell patients is if you want to wake up from your surgery knowing that everything in 2023 that can be done to tighten your skin has been done, then use this. However, it's not going to be the difference between a terrible result and a good result. If you're relying on it for that, you're probably doing the wrong operation. So that's my really long answer to that, but I don't know.
Okay, Dr. Jalalabadi, I'd love to hear how you use it in your facial practice.
Yeah, so the place that we use it the most is in the neck. If you're talking about from the neck up, there are devices that are meant to be used in the face, in the under eyes, kind of with jowls, things like that. I haven't ventured out that far yet with that technology because you can get nerve injuries. And so we have, you go to a plastic surgeon, you send a patient to 10 plastic surgeons, you get 10 different plans. And so people just figure out what works best in their hands as a surgeon to deliver a solid outcome, a solid result. And so I do love it for the neck, especially when used in conjunction with liposuction. You get that little bit of extra tightness. It's great. But, it is, like Dr. Galanis was saying, you can still get great results without it. So, for example, microneedling with radiofrequency. My personal thought is the majority of the benefit that you get from something that is like radiofrequency microneedling actually comes from the microneedling aspect of it, because we do get great results by just causing micro trauma to the skin. And in fact, it can be dangerous to mix radiofrequency in with it if it's used in the wrong hands. You can melt the fat, that precious fat in your face that keeps you looking young and youthful. It keeps your skin envelope nice and tinted. And if you melt that fat, then you start actually doing the reverse of what you want. And you get a little bit of drooping, you get little jowls, you get deeper nasal folds, things like that. So it's a good technology. It just needs to be employed the correct way in the right hands. And so still, back full circle, just make sure you go to someone who has good results and knows what they're doing with their tools.
Look at that. Look at us.
I know.
Yes. Look at us. Who would have thought? I'm me.
I love the banter, actually. I really like it. I think it's hilarious when y'all make fun of the other doctors, too.
Oh man. Yeah. Well, no comment. Yeah. We were actually just talking about, we're going to be making a video soon. One of the things, every once in a while, we'll try to find time to make a fun video that's educational. And one of the things we were going to make was a video about sort of things that we think you got to be careful of when you're as a patient looking at a plastic surgeon. So one of the things I think is a red flag is if I hear a surgeon talking shit about another surgeon, like to a patient, for example. Patient goes in and is talking and they said, "Oh, I saw so and so did this." And then the doctor goes off and that guy's a quack or doesn't know what he's doing or this woman's an idiot, blah, blah. Yeah. It's a huge red flag. I mean, even if I think it, I certainly don't say it. It's certainly something I'm keeping myself. I think it's a really weird thing, but we do see that. You do hear about these stories all the time.
But it's totally fine for us to do it amongst ourselves.
Yeah.
Oh, for sure.
You're back and forth, yes, but other people, no.
Just don't tell the patient.
Yeah, exactly. I just think it's a bad one.
I really like interviewing the surgeons that are younger. I feel like we have, or like younger, like in your 30s and up above 30s, not.
I'll see myself out.
No, let's see. How old are you? I'm sure you were what? Like
46.
I was going to say 45. Dr. Jalalabadi, how old are you? I'm
34. Baby.
See? I knew if for 30s and up.
Yeah,
we're more, I feel like you guys are more open to newer things and advancements, and you're kind of open to new ways of doing things versus the older doctors who are a little more stuck in their ways and kind of badmouth the younger doctors who are doing the cool new things and trying the new techniques. So I do hear the doctors badmouth the younger surgeons who are trying the new stuff.
I think there's a flip side of that, if I'm being honest, because I do get that perspective. I think if you're someone who's very experienced and been doing something for years, you've probably been around enough to see a lot of new things come out and fail, or a lot of new things come out that end up causing a lot of problems. So you've seen that. I mean, I've seen it in my career, which is still very young, but I've been out in practice over a decade, and I've seen these things. And so I do get from the standpoint of seeing, especially in the world of social media, I will tell you, when you have someone who's been out of training for 1 or 2 years and is getting on social media like they're an expert and experienced in everything, when they're not. And so I can understand from that perspective, as someone who's been more experienced, let's say who's out there who's like, hold on there, young buck, like, let's wait and see. You got to wait your turn. You got to sit at the table, so to speak. I get a little bit of that mentality. I think there's room to be in the middle. I think there's room to be, I think we're in kind of a sweet spot of being close enough to some of the newer things to give them a go appropriately, and not rushing in and calling something the end all be all, but experienced enough to say, like, take our time with it and not sort of talk out of turn that these older people are idiots and this is the thing you have to do, if that makes sense.
And that totally makes sense. And I agree with it because I have seen, I was a patient coordinator for over a decade, and I did see complications from new procedures, new treatments that we would see in the more established office of, well, that's so new. For example, Artifil, permanent filler. Like whenever that came on, everybody was like, oh, permanent filler. And now it's like, what? Permanent filler? Why would you do permanent filler?
Yeah. Well, even looking at something like Quo, which just came out recently and was kind of billed as this thing that's going to, and cellulite, it's just an injectable, it's going to take care of everything. And 1 year later, it's off the market. Yeah. So there's enough. I think there's plenty of examples out there of evidence to be careful about kind of trying a new thing and jumping on board it.
Sure. And what I like to do with the podcast with this show is educate the audience so that when they're out looking for their surgeries, they know what to look for. Like, what's a red flag? What's a green flag? Like, this surgeon knows what they're doing. And I really like how you guys on your Instagram educate a lot, especially I like to watch Dr. Jalalabadi when he's walking and giving his tips.
Oh, thank you. It's a good one. Those are good.
They're great. And I know the patients really appreciate it because all they want is just more information. And my girls, when they're looking for a surgeon, they don't really know, like, what am I looking for? Am I making the right decision? Where should I go? And with this show, I really like being transparent and just giving the facts. This is what you can look for and what would help you get a result that you're going to love for a very long time. And one of the things that I always steer away from is trends and new things that aren't really tried out yet because I've seen it go bad.
Yeah, there's two things that I love about educating patients. One is people want to know. And so when they're seeking that, and that's my favorite thing about social media, be it biohacking or whatever you want to learn on YouTube, you have so much access to information. Hopefully you're finding the right information. But we love informed patients. And the second thing is it attracts informed patients to your practice. So now you're getting more responsible patients who are doing their proper homework. And it saves a lot of time and discussion because they are now educated about whatever it is that they're coming to talk about. You can have a very high level discussion. So it makes the whole experience more enjoyable for me. It helps attract the patients that I enjoy having into my own practice.
Beautiful. I'd like for you to tell us what's your favorite procedure to do.
My favorite procedure, hands down, is a facelift. And I mean, the face and neck lift part, but looking at the whole face globally, understanding the science of aging, you can see patterns and how people's face age, depending on their genetics and their habits that may happen earlier. Next week, I'm doing a facelift for a 35-year-old. That's not common, but, she lived a very stressful life. She's actually a surgeon. And so, that may accelerate the aging process. And so to be able to just kind of restore the foundation of someone's youthful face, it just makes them kind of gives them this radiant glow, not just in their looks, but their personality. I love making people feel and act, kind of have that youthful playfulness about them for as long as possible in their lives.
Oh, that's beautiful.
I want to have a Facebook with you, like right now. I want to have a Facebook.
He's like, I'm sold. Let's do this.
Yeah.
Okay, Dr. Galanis, what's your favorite procedure?
I mean, one of the things that I've been doing kind of as the years went by that I kind of started doing more of were procedures that involve multiple areas and kind of doing a body transformation, if you will. And people talk about mommy makeovers. And traditionally, mommy makeover usually referred to breast and abdomen or breast and torso. And so certainly that is kind of the cornerstone, but also kind of bringing in other areas, BBL, arms, thighs, and doing large surgeries that incorporate a lot of different areas. And there's something for me that is always really fulfilling or gratifying working with moms in the sense of, these are patients who are coming in who, there's a part of their identity that they, I don't want to say they lost because of pregnancy. They're happy to have their kids. They're very happy, with their families, but there's a part of their identity they're looking to reclaim. And so for me, I started a lot in reconstructive surgery. And so this was a very easy bridge for me in the cosmetic world into something that's kind of like restorative plastic surgery. And when I would see moms who would have this operation and the difference, when I saw them in consultation and after surgery, is really difficult to explain because it was just sort of almost like a reclaiming of their identity, a rebirth, so to speak. And it's really fun. It's really powerful. And it's sort of like something, who doesn't want to help mama? You know what I mean? Who doesn't want to help someone who's done the ultimate selfless work in terms of having and raising children, and frequently have guilt about having surgery? I mean, I have conversations all the time with them where they're like, it's hard for them to make that jump to now I want to do something for myself, because for years they've been second or third or fourth or whatever in their own eyes. So I love those cases, and I've kind of dedicated, so much of my practice to it and getting better at it. And I don't ever think I cracked the code. There's always ways to improve on it, but those are the ones I love doing them. They're hard though. They're physically hard.
Yeah, for sure.
An Oscar here to give out.
Thank you. So many people are saying.
Now he wants to have a mommy makeover.
Yeah. There you go, buddy. When was the last time you had somebody eat or drink? Go put you in the operating tables out there.
I was really curious for you to tell me about your hybrid tuck. I saw you write about that, so I'd love to hear about it.
So, I'll tell you the approach to sort of body rejuvenation. Traditionally, when we're coming out of training, it's liposuction and tummy tucks. And then there's a small percentage of people that are mini tucks, but those are rarely indicated. And the more I was doing it, and then as technology sort of kind of arrived into the scene, and it kind of became this thing where how can I incorporate the technologies? I did training down in South America in terms of body contouring, because that's, in my opinion, where the greatest body contouring surgeons in the world come from. And so I took the things I learned from them. I was trying to incorporate technology, and I realized there was a subpopulation of patients who were either traditionally lipo patients or traditionally tummy tuck patients, but they're in this gray area. And I looked at this technique whereby I could still repair muscle, still tighten skin, I could still take a little skin out. The recovery was a little bit easier, the incision was smaller, and I didn't have to cut around the belly button. And so I started doing it a few years ago, and I had a few select patients, because when you're starting to do something like this, I'm not saying you're experimenting on patients. Conceptually, you have a good plan. It makes sense. But when a lot of people aren't doing it yet, there is a little bit of this kind of, you're dipping the toe in the water and picking just the perfect patient. And then over the last few years, I've realized I can capture more patients with it. And I realized I could get good results. The patients were really happy with that result. And it could be any number of reasons. Maybe they were better for that surgery. Maybe they were horrified of having a belly button incision. And it's not for everyone, mind you. But so essentially, really quick, what it is I use it close to what a mini tummy tuck incision is. From the inside, I repair the muscle because I release the belly button from underneath, and then I'll reattach it to reconstruct it, but all from underneath. I'll use a radiofrequency skin tightening for the top of the abdomen and the waist. And then the bottom, I'm pulling down the skin from that mini incision, so I tighten the lower. And then I use sort of a medium depth liposuction using Vaser to sort of create some contours. And people do great. And it's a little bit of an easier recovery. So
that's amazing. Did you guys hear that? I hope y'all were listening. So you do a mini tummy tuck incision, right?
Yeah.
You do a muscle repair.
Yes.
But you don't go around the belly button on the outside, only on the inside. So you disconnect it, do the muscle repair, connect it back down, right?
Yes.
Do radio frequency up top above the belly button for that skin tightening, and then pull like a mini tummy tuck underneath with a small incision.
Yes.
Wow.
So the population of people that this fits are people that have muscle separation, they have stubborn fat, a little bit of laxity, but not a ton. Because if they have a lot of skin laxity above and below, they should get a conventional tummy tuck. But if they have a little bit of laxity, even a little bit above, there's a certain test I do in the office to assess their laxity and kind of stratify into each group. But there's more patients who are candidates for this than I originally thought when I started doing it. But I originally thought I could get away with getting a good result. So it's been
You're
fun.
blowing my mind, because I'm like, man, I have so many girls who are like in between, right? But they need the muscle repair, but they don't want to have the big tummy tuck, but they're not fit for just liposuction. So they're kind of this in between.
100%, yeah. And it was just because it would be tough with those, because you meet these people in the office and be like, I might be able to get away with this, and I needed something kind of in the middle. And this was kind of that perfect compromise for the patients.
I love it. So, Dr. Jalalabadi, I know you talk about the weekend facelift. Can you tell me about that?
Yeah, so it's basically a neck lift, actually. And so it is a lower half of the face The incision in a facelift usually comes up the sideburn into the ear and then down the lobule, this kind of flimsy part of the ear, around the back, down the hairline. In the weekend lift, neck lift, you can just keep the incision just to the bottom part of the ear, and it hides so beautifully in the crease. And through this incision, you can then access all of the neck, the soft tissue, the muscle that the platysma muscle, this muscle that men are really good at flexing and women kind of don't know how because they don't shave their face. You pull it up and you can anchor it to give that nice snatch jawline, as people like to talk about.
Snatch jawline.
Is it snatch?
I'm speaking to the masses.
Oh God.
They
You
understand.
gonna do a TikTok dance next? Is that
Only if you're in it.
not happening?
Y'all are hilarious. Okay, so could you tell our listeners because you also do deep plane facelifts. So could you explain to my girls the difference between a deep plane facelift and a regular facelift?
Yeah, so the traditional regular facelift is called a SMAS plication. So in the layers of the face, you have skin, subcutaneous fat, and then you have your SMAS. This is like a fascial layer that sits on top of your muscles. And then you have your muscles and the nerves and then the deep fat head. So when you do a deep plane facelift, we go under the SMAS. So we're actually lifting that glide plane off the muscles and setting all of the tension of the facelift on that deeper structure. And through that, we actually can release some of these facial ligaments that have been studied. We know where they are. We can release those ligaments. And so it gives you much more play and tension-free repositioning of your facelift. It's supposed to last longer. You don't have less problems with skin positioning, redraping. Classically, facelifts with pulling faces out kind of this way, getting a windswept appearance. Now doing proper vectors, we can actually set that deep plane in a proper vector and then redrape the skin very tension-free, which makes even more beautifully hidden incisions. Tension on skin is what creates wide, nasty scars. And so when you do the regular facelift, conventional facelift, they would just release the skin off of this mass very far and then use stitches to basically, plicate together, bring together the SMAS layer. And so you would get that plication down here that can leave a pleat. Also, when you release the skin, you are more at risk of having skin discoloration. So by doing a deep plane facelift, you actually minimize the separation of that skin from the SMAS. And so you have less chance of having skin discoloration on your face, getting a little capillary breakdown and hypopigmented skin, for instance. So that's the type of facelift that I do pretty much for everyone. You can also do that in the neck. So there's deep neck lifts. And what that gives you access to is under the platysma, even in that weekend lift where you make an incision here, we make an incision here, and that gives us access to all of the deep neck structures, the floor mouth muscles and the submandibular glands. So sometimes if you look at some facelift results, you see a nice jawline, but then you see a little bulge. You see a couple of bulges here, you see some bands here. By doing a deep neck lift, you can actually address and reduce submandibular glands, you can reduce the muscles, if you have to, the anterior belly of the digastrics. And so having these deep plane capabilities and the comfort, it takes people a long time to get comfortable with those deep layers of the face if they didn't train in it. And one of the beauties of how I trained my fellowship coming to Beverly Hills, working with people like Ritu Chopra, Ben Saleh, seeing them do deep plane facelifts and then me actually going and growing my own practice, doing them on my patients, has gotten me comfortable very early in my career, which I'm very thankful for, because I'll talk to surgeons who are 10, 15 years out trying to now convert to a deep plane facelift. They don't have a lot of direction or they weren't in their training phase. And so it becomes a little more challenging to kind of get over that learning curve.
Do you like to do multimodal where you're doing a lift and skin treatments at the same time, or do you separate them?
So I do something called icing on the cake. I will focus on the surgery part of surgery in the operating room. In that first week when the patients are, you're usually pretty significantly swollen for about 2 weeks. in that first week when they're coming to me for suture removal, I will do a CO2 laser if they need it, because a facelift doesn't address the fine lines and wrinkles and the textures of your skin, especially around the mouth. So central facial aging is not something that's treated in a facelift. The most I can treat with a facelift is kind of to here. And so to be able to have the technology with lasering, microneedling, things like that, we can actually aggressively go after certain parts of the face during that healing phase. So it kind of compacts it into, you're not healing from your facelift, and then later on you're going doing a laser that you're going to have 2 weeks of downtime for. We kind of front load everything.
Love it. I love that. So, okay, let me ask you a couple more questions. I want to know, how is it going to Dubai for surgery?
I mean, I love it. I tell people I went through 3 phases. So the way it started is, it was several years ago, someone I met who was kind of, she was an expatriate. She's a British woman who was kind of on this, she was a famous person from the UK. I met her in the US, and she was looking at bringing surgeons to Dubai. Their motivation was Dubai is the city of luxury. It's also for people who want it from Europe, who go there for surgery because there's no paparazzi. So it could be very private. You could have surgery kind of in this nice environment, which would get away from. So they were trying to bring surgeons over. So I kind of went over there, visited a clinic to make sure that the infrastructure was fine. So I started going, I don't know how many years ago it was now, and I went through 3 phases. At first, it was really fun and exciting because Dubai is a great city, and it was nice to kind of break from here. And then I went through this phase where I was kind of exhausted, and I was like, do I need to keep doing this? I'm plenty busy here. Honestly, it's not a money thing. I don't make more going there than I do here because I'm busy here. So it's the money. It wasn't really for the money at that point. But at that point, I had kind of established some friendships there. I had some good friends that live over there. It's a nice break from LA, to be honest, because when I'm over there, it's 11-hour time difference. I mean, I am cut off in this world. When people are awake here, I'm asleep, and vice versa. And I love the city. And so now when I go back, it's really fun. I've split it up in a way. I only go there 3 times a year, go for about 2 weeks each time. And I love going. And, I have a good team there. I have an excellent coordinator out there. My clinic out there is really attentive. I have physicians there who I trust and know who, if there's an issue while I'm away, they can address it. But I usually am seeing people before I leave, and everyone's kind of tucked in until my next visit. And I'll do cyber follow-ups with them. And I have all the technologies there that I have in the US. I have a Vaser device. I have Renew Beyond. I have all the things that I use here, I have over there. So I love it. I don't know how much longer I'll keep doing it because it is tiring. It's a lot of work, and sometimes the jet lag, I've gotten used to it, but sometimes it can hit you pretty hard. But I don't know. I love it.
Nice.
Do you miss me when you go?
No, I don't miss you at all, actually. It's really, I think I'm making it 3 weeks. I think I'm making it 3 weeks now, maybe 3.5.
I would love for y'all to tell us about okay, so we know on Instagram, right? We can't really share that many before and after pictures because we start getting shadow banned. So I know y'all are resorting to showing other parts of your practice and your personalities and all of that. And the feuds are life. I live for it. I love reading those comments. So how did that all just start happening?
Which one specifically are you talking about?
Oh my God. The video where you were like your top 5.
So I'll tell you one funny story. So there's a guy in Philadelphia. His name is Christian Sugo. He's a great surgeon. He does a lot of tummy tucks. Calls himself Tuck Daddy. He's a real piece of work. But so he and I actually met through Instagram maybe 7 years ago, 6, 7, long time ago. And we started messaging there, and we have very similar sense of humor. We're both very sarcastic, and we don't take ourselves that seriously. Like we like poking fun at things, and And so then we started kind of going after each other on Instagram, and we would leave. He's always leaving a smart ass comment or a post of mine. When he posts, I'll come after him. And one thing I will say, in fact, I'm going to send this to him. You better fucking see this. Excuse my language. But I can claim that there was once a comment I left on a post of his that burned him so bad that he took the comment down. And I can say that because I've never done that to him, and he knows it. And he knew one time I got him, and I will never let him live this down. But the funny story behind this is we were once going to a conference where we were both speaking at the conference. And someone called us individually and said, hey, listen, you and Subio are both going to be on the dais at this conference. Are you okay with that? And I'm like, y'all really think we hate each other in real life? Like, no, we're playing, like we're friends. Like people were actually thinking we hated each other. So to this day, we still do this, and we'll pin each other's comments to the top. Like when he burns me, I'll just put it to the top so everyone can see it. He gets me pretty good. He's smarter than I am when it comes to smart ass remarks, so I'll give him that. But it's fair thing to do. I think one thing I would say to Instagram, and we were kind of hitting on this before. So the reason I think Instagram has become an asset, because when I started my practice, there was no social media really. It wasn't that big yet. Instagram was kind of starting to take hold in Southern California, South Florida. That was kind of it, and it was sort of gradually picking up. And one thing I've seen, so it's first of all, from the patient side, it's a tremendous way, as you mentioned, you get educated. I do think you can get pretty educated on social media. You may get some wrong information, but overall, I think you can get educated. But I think the other thing that's absolutely invaluable about social media is the ability to get insight into your provider's personality. And this is critically important because I think there's a lot of great providers out there. There are people that do a lot of good work. And I think one of the things that's going to help someone find a surgeon for them is, yes, finding someone whose work you like, but someone that you kind of have a good rapport with, you vibe with, you feel like they understand you have a comfort level with them, because it's an uncomfortable thing to go to a stranger, take your clothes off and say, this is what I don't like about myself. So it has created this familiarity, which is invaluable. And that's why, I have Adele, who's helps us with our social media, is tremendous at sort of helping us get our content. But he's also great because it's critical that we still maintain our own voice on it and that people see our personalities, because when they come in, it puts them at ease. They already feel like they know us. I can make a joke about my dog or something and they'll know what I'm talking about. And it really does speed up the process. And so, as it relates to these feuds or goofing around on social media, those are insights into our personality. And it's a way for people to kind of be like, oh yeah, this is this guy, I get this guy. Or they're like, this guy's a clown, I don't want to see him. That's fine too. I'm not everyone's cup of tea, and he certainly isn't either, I can tell you that. Yeah. So, but for that reason, but that's why it's important. So when I see an account that's really curated, you can tell right away an account that the surgeon doesn't run or isn't involved with. That's fine, it's a choice, you can do whatever you want, it's not criticizing those. But I think you're missing an opportunity, particularly if you're young and you're setting up your practice, to set yourself apart by your personality. And because there's a lot of people that do great work. So, and the last thing I'll say about it is that, so I think social media is a great place to find a provider, but it is not a place where you should build expectations. And they're two different things. And I tell patients this all the time. I think you can find a provider there, but it doesn't mean that picture that you're seeing is going to be you. Be a completely different situation. Setting up your expectations should come from your discussion with that surgeon.
Is it a place where you should ask price of an operation?
Yeah, we get that all the time. I don't know. What do you think? You were a coordinator before. Do you think that when people ask about the price of surgery, how much is surgery on social media
answer?
Or whatever? Well, I'm asking you. What do you think?
You're asking, should you answer?
Yeah.
I think it'll bring probably more people to your door, because the ones who think they might not be able to afford it might realize, oh, that's actually not that bad. And that's actually a lot of what I hear. Like, oh, once I went to my consultation, it wasn't as much as I thought it was going to be.
So this is what I would suggest to that, or what I would counter to that. Yes and no. I think, so what we do is I'll say, call the office. And they'll they'll give you a range. Like, I'm not going to surprise someone when they get here and they have no idea. But I think it's important to know what the range is. Now, if someone says, hey, how much are your tummy tucks? I'm not going to answer that, because I don't know if that's your operation. I have no idea if that's appropriate for you. And not all tummy tucks are the same. If you're a heavier person, it's going to take longer. It's going to cost more. If you're someone who's skinnier, right? It's going to be lipo. It's going to be less. So I'm either going to scare you away unnecessarily with the price, or I'm going to underball it because I'm going to think, oh, that's all you need, when it turns out you need a lot more. So what I'll do is I'll tell them, call the office and get a range. And I might scare you with that range, maybe from a tiny amount to a huge amount, but so they understand that, look, they will not be surprised if you're this top end. They have to know that. We get that question all the time, and it's usually from, I think, window shoppers who are just looking for if your first question is, how much is this? It's an important question. I don't know that it should be the first. It should be your top three, perhaps. But that's where I just sort of push that to the office. We don't address it. I don't post prices. I don't criticize other people. I don't post the prices because it's going to be different. It's a range for everybody.
Everybody. Absolutely. So I think when patients are shopping, you have to see who's serious and who's not serious. Like, the ones who are serious will take that extra step to call the office, to get a price range, to figure it out. The ones who aren't, they won't take that step.
Oh, but God, the entitlement these days, like people who are just, the things they could just find out themselves like that, like, where are you located? Literally, it's like, where are you located? How do I contact you? Like, bro, I mean, it's really easy with these things to find out how to contact literally anybody. It's not hard. Like if you have a name. So there is this frustration that can come. I think there's a lot of people who are just feel entitled to access to someone. And let's be honest, I'm not on this thing all the time. We're working. We're not just sitting here at our phone.
You're in surgery.
9 and 5 p.m. And I used to get messages from patients that asked this long question that was like a consult. I still get those. I don't. And I was not going to acknowledge those. I'm like, that's a consult. Or I used to get this. I remember getting this when people would ask a question you wouldn't answer. And then the next thing would be seven like question marks. Like, why haven't you answered me? Oh my God. It's wild.
Sorry,
man.
let me drop what I'm doing so I can reply to your
I'm
message.
sorry. Yeah, let me get right to that. Let me sit down and evaluate your case and tell you if you're a candidate for surgery or not. So,
I can tell you from experience with other plastic surgeons' Instagram accounts that they're getting the same thing.
oh no, I know everyone does. I'm not saying it's just us. We're not that special. I know that, but it's just like a subject. I think that we've gotten so used to information being at our fingertips that we've come to expect now the information comes to us rather than having to make any effort. I'm guilty of this too sometimes. I found myself the other day, I was going to message someone, hey, where is something? When I realized I could literally just Google it and it would take 1 second. Why am I taking their time to find information I could? When I do the ask me a question things, every once in a while I'll do an ask me a question on Instagram. And a lot of times what I'll say is, if you can find this on Google in under 5 minutes, I'm not going to answer it. Like you can find it out. Like if it's ask me a question that's not easy to find or that's more nuanced, it's going to be more interesting, more valuable. Otherwise, you can just Google it. I'm not Google. I'll be wasting your time.
I love it. I love it.
Over. Now we have ChatGPT. Now we have ChatGPT.
ChatGPT is going to change the world. It's changing already.
Or kill it.
Okay, let me ask you this last question. So, big butts, no lies. We talk about BBLs all the time. And the BBL fear is that they're not safe. So I'd love to hear, do you think BBLs are safe, and are they safe, or are they safe?
Very, very good question. And it's something still coming up. And unfortunately, there's a lot of misinformation that still goes on. And this goes back to, I think, the conversation about clickbait. So there was a study in, I think it was 2018, it was an ACER study, and it was actually a survey study. And if you actually look at the number of respondents relative to the number of people they asked to respond, it's a small fraction. First of all, survey studies are inherently flawed. It's a self-reporting study. It's not a true randomized study. And that data from that original study showed a mortality of 1 in 3,000, which is very high, unacceptably high. And it set off all these alarms, and everyone's freaking out. And it's on all the news and whatever. If you dive deeper into what happened, number one, it was a crap study. It wasn't a really quality done study that truly incorporated the numbers of how many people were doing BBLs. So your denominator was not correct. So the 1 in 3,000, that 3,000 number was relegated to a very small percentage of surgeons. Number two, the data was disproportionately coming from South Florida. And we all know that South Florida, there's a lot of sketchy clinics with unqualified doctors doing these procedures, running 3 rooms, 6 BBLs per room, just kind of hustling them in and out. So you're going to get some really questionable conditions and not people really abiding by the standard of care. The third thing is, as a consequence of that, though nonetheless, there was a task force that came out and said, okay, this is what's going on. And we do the autopsies, we're realizing that people are injecting into the muscle and it's gaining access to the bloodstream because there are some very large branches of the iliac vein that they can get into. And they get these giant emboli that get into the bloodstream and cause sudden death. So they said, okay, no more injecting in the muscle. This is the location of where you should go with the cannulas. You should not jackknife the bed. You should be careful if you're jackknifed and go from below. There's a lot of these guidelines. And they redid the study, the same study, they redid it 2 more times. And the most updated data with kind of these guidelines in place, and actually you're doing a study that encompasses people that do this. The data suggests that tummy tuck is more lethal than a BBL. So the answer to the question is, yes, it's safe, provided that you're going to someone who knows what they're doing, is following the guidelines, is not injecting the muscle, which just about anyone who knows what they're doing in BBL surgery is doing now. I've been doing them for almost a decade. I have no mortalities, and I'm not unique in that regard. It's very rare. So unfortunately, Once something like that gets out there, and that information just keeps cycling around because it's more interesting. It's clickbait. And then someone will have a doubt and be like, see, it's unsafe when it could be, oh, that one $15 or something.
Something I learned from an interview with Dr. Alex Earl, he told me that when they looked at the data, the surgeons that were causing these injuries had less than 50 BBLs under their belt.
Absolutely. I think there's a lot of things that when you really dove into it were not right. It's not to say that there weren't things that needed to be educated and corrected, because there were. There were certainly, you needed sort of people to take a fresh look at it and say, hey, how can this be done safely? And since that time, it is a safe surgery, and it's a very powerful one. And I think people do think BBL means this exaggerated diaper butt kind of, huge square look. Some people want that, that's fine. But the reality is it can be done in a variety of ways to fit a variety of tastes. And it can be done in a way that's perhaps more athletic, more petite, focus more on the curve, the shape rather than the volume. There's a lot of ways to approach it. And so there is a lot of mythology around BBL surgery. I think it's coming around, but I think you still see, some lingering drama associated with
safe.
It. Yeah.
I love the BBL procedure because I feel like it's more of a shaping. I don't, I love it because I feel like it's more of a shaping for some women. There are some women who really are looking for a certain look, but that's why I tell them, look for the surgeon that is delivering that type of look. Because
100%.
if you go looking for a XXL BBL to a surgeon that does more natural BBLs, you're going to be very disappointed because that's not his style and that's not what he does. So
it's a great complementary procedure too. Sorry to interrupt, but I use it a lot of times, not as an isolated procedure, but as part of a tummy tuck or as part of, really we're lightening the torso. And like to your point, we're shaping the body. And so it's, one of the things that was one of the greatest lessons I learned, and I teach this now, but this was kind of a time when I sort of learned in practice, was that one of the greatest ways to make a small waist is to bring out the hips. And it's not to say to make the hips, something crazy. And I'll tell you, I learned this because I remember I had a patient who was a famous celebrity who was coming into the office, and I saw her on the schedule, someone told me, and I was expecting, based on how I knew her in social media and media and whatever, that she was going to have this little itty bitty waist and very coquettish and whatever. When I did her measurements, her waist wasn't that small. And it just went to show that her waist looked small because she had the curves. And so it doesn't have to be that exaggerated, but you realize that sometimes, same thing with the BBL, it's not always about the art, it's about how you frame it. In other words, it's the areas around, if you dress them a certain way, it can change how everything looks. So that's one of the other things that people don't realize is sometimes it's a complementary procedure that it's bringing up other areas of the body. It's helping proportions in other ways.
Yeah, let me give you an example. Let me give my listeners an example. Okay, so when they do a tummy tuck, right, that's done. They do liposuction to the flanks. Now you're going to wear a dress, but you still have the hip dips that you had before surgery. The tummy tuck's not fixing that. The lipo to your flanks isn't fixing that. And you're going to put on that tight, skirt or tight dress, and you're going to be like, oh, well, what about this now? Because before you have your tummy tuck, you're mainly looking at your stomach. But once that tummy tuck's gone, now you're like, oh, well, now what about this? So that's when I really love it as a complementary procedure for tummy tucks and sculpting. And what I mean by shaping, it really helps when you're wearing your nice dresses to give you that beautiful shape.
And I mean, Jalalabadi uses, fat there's other ways fat can be used too. It's a very powerful tool in plastic surgery. And I think really in the last 20 years is when it's kind of exploded as this, in its evolution of use. I mean, he uses it in the face, he uses it in the hands. A lot of places it can be used very, effectively as sometimes a very subtle but still powerful method. So
it doesn't take a lot. I mean, just a few cc's of fat in certain places of the face. We love not wasting it. So some patients will do body work with him. And then if they're a candidate and a little bit of volume, instead of going with a box of filler, we can use that fat in certain, tasteful spots on the face. It does wonders for contouring. And then the stem cells in the fat also do wonders to make the face glow. So it's a precious thing. We don't like to waste it. So,
what someone told me the other day? I didn't tell you this. I got a DM the other day. What's that? Yeah, what is that thing? ASMR? Yeah. What is that thing that was like the sounds?
Yeah,
ASMR.
Someone told me his voice should be on an ASMR. You should gotta make an ASMR video.
You better just quit and go to the radio.
I'll say it again. Say it again. Say it again.
Say it slower.
Yeah, say it slower. Just quit. And let me get. Go ahead. That's like you do. You have that soothing voice. Anyway, sorry, I digress.
I like it. So those were my questions. I really enjoyed having you guys on. I love the duo team. I know you're Dr. Galanis, you focus on body. Dr. Jalalabadi, you focus on face. And it's absolutely a one-stop shop for my girls who are looking for the full mommy, new me, and sometimes not mommy, maybe hot mommy, new me, new year.
Yes, love that. We love it. The hot mom. We'll do the hot mom makeover. I like that.
Yes, the hot mommy makeover.
Good.
Absolutely. All right. So if my girls want to find you, where can they find you? Since we can find it on the internet, but if they don't want to go look, how can they find you?
I think so the thing that we're most active on is Instagram. Certainly on my page, it's just Charles Galanis MD. So at Charles Galanis MD. We do have a page that's just shows some results called at Galanis Plastic Surgery. Dr. Jalalabadi has his own page. Why don't you tell them what that's called?
You can find me at Dr. Jalove My Body. That's DrJalubody.
Jalove My Body. You heard that right. And we also, I think Adele, we're working with, Adele does some stuff with TikTok too, and we're kind of building that a little bit. But website's being rebuilt right now. But we're based in LA, so we're in Beverly Hills. So if you actually want to actually see us, come to Los Angeles.
It's nice.
Yeah, it's nice.
If you enjoyed this episode, please go on Apple, write me a review. It's the best way for other women who are just like you, who need help, who are looking for information, valuable information on the internet. This is how they're going to find it. So go on Apple, give me a 5-star review if you love this podcast. If you want to support the podcast, the best way to support the podcast is through the website. If you need help through your journey, if you need help finding a surgeon, if you want to join the membership, if you're looking for Bruise Juice, you guys don't sleep on Bruise Juice. Y'all know I have my Bruise Juice 30 coupon code for y'all to use if you're having a BBL, if you're having liposuction, if you're having a tummy tuck, if you need to be using Bruise Juice all over your body. Stop using those other brands that are not tailored for your post-op recovery. Bruise Juice is formulated for your recovery. It's amazing. It nourishes your skin. It helps your fat transfer live. Don't sleep on Bruise Juice. Bruise Juice 30 is the code.
And don't forget, new episodes every Monday. I'll see you then.